Hello, my name is Dr. Michael Grant,
Yeah.
born and raised in El Paso. Well, I actually stumbled into dentistry. I actually didn't want to initially be a dentist. I wanted to actually get my PhD, and it wasn't until my buddy convinced me to go and see his cousin's practice. And once I got there, I totally fell in love with the whole thing. I thought it was the coolest thing I've ever seen. I'm a huge nerd, like materials nerd, and I got my degree in chemistry from UTEP. So seeing all the stuff that I could use and how dentistry is not what I thought it was, just the boring fillings and fluoride, and actually really fun. And I fell in love with it, and I was lucky enough to get into dental school my first cycle. I really enjoy dentistry, actually. I really like getting up in the morning and not knowing how things are gonna turn out. Like I can have a patient that I'm planning to do a filling, but it could turn into something else. Or like it's constantly every patient, every tooth, every minute of the day is I have to solve a puzzle, and I try to finesse my way through something the best that I can, and hopefully it comes out, the best obviously it will come out, to my standards. My dental philosophy is high quality, and I want to practice. I like practicing the dentistry that I was taught in San Antonio and that I was taught in Arizona, and um, I do things by the book. Everything is as it should be done. So basically, standard of care is my philosophy. Is if I can't do something that is in the best interest of my patient, if I can't do something that is not up to the standards that it should be done, then I refer it out. And I treatment plan that way. I execute treatment that way. Everything is done always in the best interest of my patient to the highest quality standard that can be achieved. To America's High School, class of '09.
Okay.
Yeah.
Okay. Cool.
Then I went on to UT El Paso for my bachelor's in chemistry. I graduated in 2014. Graduated from San Antonio Dental School in 2018, and then I did a one-year advanced general practice residency at AT Still University in Mesa, Arizona.
Home practice. Okay.
Yeah.
Good.
It's like I'm familiar with El Paso. It's booming. Things are changing. Now's a perfect time to come back. There's a lot of cool stuff to do. I just grew up in this community. Why not? I want my patients to know that that, like I said, everything I do for them is in their best interest. And I will sit down, I talk to my patients, I explain my treatment plan, why they need it. There's none of this, boom, blah, 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 boom, 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 you need this, you need this, you need this, and leave the room. It's like everything is done for a reason. And I treat my patients the way I want my family treated. And dentistry is a hard thing to understand. Not a lot of people know about it. And it can be scary. And to me, when a patient is seated in the chair, I've won the hardest part of the battle, which is bringing them in for treatment. The rest of it is up to me to make them comfortable and do what they need done. And I want my patients to know that. How do I say it? That I do not touch a tooth. I don't extract a tooth. I don't do a root canal on a tooth unless it really needs it done. I practice conservative, high quality dentistry, and that's what I want my patients to know.